sexually transmitted infections, and other reproductive problems. STIs may cause illness, poor sexual function, and decreased fertility. Taking precautions to avoid STIs can improve the sexual health and fertility of an adult. STIs are discussed in the immunity and infectious diseases presentations. Preventing STIs is also discussed earlier in this presentation. STIs can be caused by bacteria, viruses, or parasites. Examples include gonorrhea, genital herpes, human papillomavirus infection, HIV/AIDS, chlamydia, and syphilis. Genital herpes is caused by the herpes simplex virus. It's spread by skin-to-skin contact during sexual activity. There's no cure. It can have painful and itching sores around the genitals, anus, or mouth. Human papillomavirus, or HPV, is the most common STI. It's spread by skin-to-skin contact during sexual activity. It can cause warts, and in some cases can lead to cervical cancer. Chlamydia is a bacterial infection that can lead to permanent damage to women's reproductive system if left untreated. It often appears with no symptoms, although it can lead to unusual discharge and painful urination. Gonorrhea is caused by infection with the Neisseria gonorrhoeae bacteria. It infects the mucous membranes of the reproductive tract. Transmitted through sexual activity, it can also be spread from a mother to baby during childbirth. Many people are asymptomatic, but they can have discharge and painful urination. Left untreated, it can lead to permanent reproductive tract damages. It can be cured with an antibiotic. However, you can get reinfected if exposed to it again in the future. Syphilis is caused by infection with the Treponema pallidum bacteria, transmitted through direct contact with a syphilitic sore, and can be passed from mother to their unborn child. There are stages of infection. It starts with sores, then progresses to rashes, then has a dormant stage where there are no visible signs, then can lead to organ system damages. Some of these stages can last years and will continue to progress until organ damage, if left untreated. It can be treated with an antibiotic. However, treatments vary depending on the stage of infection. HIV, or human immune deficiency virus, is the virus that causes AIDS, acquired immune deficiency syndrome, in human beings. HIV damages the immune system so that the body is less able to fight infection and disease. Untreated, HIV most often turns into AIDS in about 8 to 10 years. Having AIDS means your immune system is very damaged. People with AIDS are more likely to develop diseases they wouldn't get if they had healthy immune systems. These are called opportunistic infections or opportunistic cancers. Some people get opportunistic infections during the acute stage of the disease. You can get infected with HIV if infected blood, semen, or fluids from a vagina enter your body. This can happen if you have sex. You may become infected if you have vaginal or anal sex with an infected partner. If you share needles to inject illicit drugs. Sharing needles and syringes that have been infected puts you at high risk of HIV and other infectious diseases, such as hepatitis. If you have a pregnancy, give birth, or breastfeed. Pregnant people who have HIV can pass the virus to their babies. People who are HIV positive and get treatment for the infection during pregnancy can greatly lower the risk to their babies. HIV can be prevented by using contraception that protects against STIs and by not sharing needles. For more information, visit the Mayo Clinic. Anemia is a decrease in the number of red blood cells in circulation, leading to many problems including fatigue, anxiety, decreased sexual health, and headache. In order to make enough RBCs, you need to have enough iron in your diet. Iron is an important mineral for RBCs because each hemoglobin molecule contains 4 atoms of iron in its oxygen binding site, and red blood cells can't be produced or carry oxygen without iron. Iron deficiency is very common in children of sub-Saharan Africa, impacting all areas of child development. Anemia may lead to poor egg quality, poor sperm quality, and poor uterus function. Many short-term, limited studies also suggest that anemia caused by iron deficiency leads to a decline in sexual desire and performance. Getting enough iron in your diet by eating meat, like beef, pork, lamb, chicken, etc., eggs, organ meat like liver, heart, or other organs, fish or shellfish, leafy green vegetables, peas, beans, and iron-fortified cereals prevents iron deficiency. Pregnant and nursing mothers must consume plenty of iron-rich foods to ensure the healthy development of their children. Abnormal menses, or irregular periods, may result from many causes, and in some cases the cause is not known. Women with irregular periods may have more difficulty becoming pregnant because they're not able to predict their ovulation or may have very infrequent ovulation. Hormonal cycles control the monthly cycles of females. Abnormal menses are the result of an abnormal uterine cycle and the unpredictable or infrequent shedding of the lining of the uterus. As we learned in this presentation, the uterine cycle is under the control of the ovarian cycle, which is under the control of the hypothalamus and anterior pituitary. So changes in hormonal cycles can lead to a disruption of normal periods. What are the causes of disruptions in hormonal cycles? There are many. Stress, poor nutrition, low body fat, poor thyroid function, or some types of birth control, like IUD, birth control shots, patches, or implants, may all cause changes in monthly cycles. Some medical conditions can cause very heavy bleeding or painful periods. Endometriosis, which is tissue normally growing within the uterus growing outside the uterus, and uterine fibroids, which are non-cancerous growths in the uterus, are two examples. Women struggling with these symptoms should see a medical provider.